argument is that it's in the private sector's self-interest to move as rapidly as possible to implement the health market inquiry recommendations. In the private sector's self-interest. Even though a lot of people are saying, hang on, this is going to do all kinds of negative things to the bottom lines of all kinds of people. So let me articulate why I'm saying that. And so my answer to you is the health market inquiry could become irrelevant if the NHI is implemented in the current form as envisaged in the NHI bill. But the NHI bill is out for public comment. There's still a lot of detail that is lacking in the details of what the NHI will actually do beyond a single payer and payment for performance and private providers. But it doesn't get into the detail of how that's going to unfold over the next years. And at the moment, there's long been a lack of faith and trust in the private sector in terms of offering good value for money and as a reliable partner in the goals of the health system. So that's my initial answer, but let me take a step back and maybe explain why I'm saying this. So the reality in South Africa is we carry a very heavy burden of disease. So Mosweledi always talk about the quadruple burden of disease. And for a lower middle income country, our health indices and our health status is appalling. Our health system is defined by inequity. Inequity between those who can access the public sector versus the private sector, inequity for those in rural areas versus urban areas, and a number of other forms of inequity. And we're a lower middle income country. We're not a poor country. There's also a limit to how much of your gross domestic product you can spend in the health sector without damaging other sectors of the economy. And we're sitting at 8.5%, and more, we don't have to go into the details of the proportions that go to the private sector and the public sector and how many doctors are in the private, but that's all in the health market inquiry report. But what we know at the moment, and we've known it for a long time. In fact, we knew it before the health market inquiry, but they had 5 years to put all the hard facts and details and evidence into their report. The first thing is we know we don't get value for the money we invest in the public health sector. And we know that we have performance problems, we have corruption, and we have problems of quality beyond what we should have for the money we're putting in there. So we have a problem in the public sector. What we now have is an HMI report that details that the private sector is also not getting value for the money spent in the private sector. So there's over-servicing, there's some pricing issues, but also there's a lack of integrated care in the private sector as well, driven by a number of models, including how doctors are required to work in their own specialty. They can't work as integrated teams, they can't be employed, and a number of other factors. So what we can say is that we have a health sector in the country that has a structural problem. There's a structural problem in the public sector, and there's a structural problem in the private sector, and we need to look at how we fix those structural problems. If the private sector starts to offer a much more cost-effective model in there, then it can start making those arguments. If it's not the HMI implementation that's going to do that, what is?